There we are. We are live, and let's bring in Mike Soter, State Representative Mike Soter, with some exciting news. What's happening, buddy? How are you?
Hey, what's happening? 2 weeks go by fast. It feels like it's every week.
I was looking back. I thought it was last week, but no, it's this week. It does go by fast. Which in a
Listen, I keep
pandemic,
track of it because I miss talking to you on
oh,
weekends.
in a pandemic, we want this to go by fast. So,
Exactly. Imagine a year ago last week.
is that
Uh,
crazy?
yeah, the state of emergency, and I think we started talking not too far after that. I think maybe a week after we started talking about things. So, really, really interesting.
Well, as far as local business goes, remember that it was the restaurants that really got hit because they closed down at like 5 o'clock on St. Patrick's Day, and they announced that the day before.
Exactly. It was a tough time, and we've got a lot of restaurants that unfortunately have closed, permanently, and we're working hard. But we're going to be in, just real quick, we're going to be in session today. We're going to be voting to help some small businesses, especially with these PPP loans that were forgiven, and we're also going to be taking care of the unemployment insurance issue that they've all been really worried about. So good news on the horizon for them. We're advocating hard for them, and I'm also advocating to try to get my bills moving forward out of the emergency preambles. I'd love to see some sort of money come to them out of the meals tax, back to them, so that we can give them the boost they need to get back on track and keep people safe. They need money. The biggest thing is they need money to change their ways on how to continue to keep people safe even after this pandemic. I think a lot of restaurants realize that this is the new way of life, and when these things hit, they want to be well prepared for the future. And if there's future outbreaks of whether flu or coronavirus, these restaurants are telling me, look, give us some of that money back, and we can invest in making sure that we keep moving forward. So I'm pushing my bills. I didn't want to muddy the waters today by filing any amendments of that. So, you kind of do the right things, and you look at these two big things today that are going to happen. And, I'm really happy that I signed on myself. The bill that's moving forward is language that was in my bill with Minority Leader Jones and many of our delegation. Some of the language that Representative Murray put forth for this also in the PPP is also going to be moving forward. So you've got a great delegation around you in your listening area. You've got, folks like Representative Meridian that, is pushing it. Rep McKenna, Rep Roy also was pushing this. So you've got a great delegation. It's really helping. It's not about Republican or Democrat.
Yeah.
It's about, helping our businesses, and you got a great delegation. And we as a people have a great delegation working.
Yeah. Oh, that's great. It sounds like we're getting some positive information or announcements in the near future as well. Through the grapevine, I'm hearing that guidelines are going to be relaxed just a little bit more and more as announcements are made, because we're doing so well that by summer, we should be able to get out in the backyard with 10 or 20 of our friends and feel comfortable.
Yeah, and I think as we get more people vaccinated, and I think that might be our lead into our next news, is that as we get more people vaccinated, obviously, the CDC came out, and then the Commonwealth of Massachusetts said, look, at people who are fully vaccinated who are traveling don't have to, take the test. They don't have to quarantine. So that's the outcome of getting the vaccination out there and getting it done. If you choose to take it, go get it. I am, again, I'm not a big vaccine person, but on this one, I'm going to do it. I want to get out there and do it. And I wish I could have it tomorrow, but I want to make sure that my constituents get it first. The people who need it first get it. I figure if one shot for me, I can wait. I've been through the coronavirus here, and I know what to expect. So, I got to continue to be careful, but I think our delegation are all in the same boat. We would love to all have it, but we also understand that we have constituents that need it more than we do right now. So, we're pushing more of that avenue, and that leads into the great news in Uxbridge. We
this is great.
That approved. The great people of Uxbridge and the hardworking town administrator there, Steve Setti, who's not, he's very familiar to the area because he was in, I believe, Hopedale at one time as the town administrator. So he's very familiar with the area. And, he worked hard with his Board of Health team, and they formed a coalition with 13 different towns, Board of Health, town administrators, fire chiefs, emergency management teams. And when the governor changed the requirements, they certainly jumped into action. They put a plan. They presented me the plan back in January, and I was advocating it for Uxbridge, and it was just 5 towns, and that was what the guidelines were. And when I saw the plan, I immediately reached out to my colleagues. Dave Meridian. I showed him the plan. Representative McKenna showed him the plan. Representative Murray. I sent him the plan. Senator Moore. I showed him the plan. And we strongly advocated hard that we could meet the 750 threshold. Yeah. So we took all of us that I mentioned there took a very hard business approach to this, to say this is no different than somebody coming to you and presenting a new idea for a new concept and asking for money, basically, for that concept. And we went to the Meridian. I was talking to my colleague Dave Meridian, and we went advocated strongly on both our ends. He took part in the DPH. Representative McKenna also was working with different hospitals like Harrington Hospital. Senator Moore was tapping into FEMA money and things like that we could tap into to get this all together. Representative Murray was brought in because we weren't sure if Milford was on that cusp, but he also represents Mendon and Hopedale. So Representative Murray got right into it and was trying to work through all the channels with Milford Hospital as vaccine. So there was a lot going on. Working with these folks, but more importantly, it's not about us as a delegation, how hard we worked. It's how hard the locals worked, the local communities, every single one of those communities, Milford, Hopedale, Mendon, Douglas, Oxford, Grafton, Sutton, I'm probably going to miss a few, Blackstone, Millville, Bellingham. They all worked locally together, collaboratively, so that we could put this together. And they put the teams together. They put everybody together to make this happen. I'm truly, truly excited that it's going to be here. Monday, we're going to have a live press conference. I know I sent it out to MyFM.
Yeah, we've got our guy, Johnny Wilbur. He's going to be coming down. So just let us know when he can be there. And but we got the press release. He's excited about being there. Is the governor going to be there?
We reached out to the governor. Obviously, he's extremely busy.
Sure.
We reached out to the governor and the lieutenant governor. And I just want to give kudos to Governor Baker and Lieutenant Governor Polito. Lieutenant Governor Polito, because, she is from Central Mass, really strongly advocating for Central Mass. She did a tremendous job listening to us, pushing and advocating with us. To get this done. She recognized this southern New England, southern Massachusetts really needs this. It's a big void. Governor Baker, day in and day out. I told you I have differences back and forth.
Sure.
But he kept in communication with myself. I know Rep Meridian had conversations with him, and also with Lieutenant Governor. He was communicating. Representative Meridian was communicating with Karen Polito to just keep things. Hey, this is what's transpired. This is what's going on. We still want this, and obviously, the biggest thing is supply. I mean, we're looking to get this open March 22nd. We're just hoping the supply. I know the order of vaccines in. I know it's there, but the locals are gonna, this is big for them. They want to take the media through, and this is a great time for the media to actually get people to feel comfortable, take pictures of the environment, so people know what to expect when they get there. And this press conference is really going to be homing in on them, how hard they worked, how dedicated they were, the challenges they faced and how they overcame them. And basically, it's a wonderful site. It works perfectly. The plan is fantastic. And I'm extremely, extremely proud of this delegation and working together and just not worrying about each other's egos on this one and just working really, really hard. Sometimes you get these things and, the pie in the sky ideas sometimes. Yeah. This was never a pie in the, when I first looked at it, I said, oh boy, I don't know if we can make this happen. But then as I started looking at the plan and seeing what they've done, it's tremendous for the Milford area. Everybody should be very happy that, Rep Murray was on top of this, communicating with me constantly on this. It's just a wonderful, I think, thing that we have. It's more accessibility everywhere, to get more people vaccinated if they want to, and get more appointments out there. And
How will this work then? So when it does open up, what's the process? I don't know what the process is. My number hasn't come up yet, so I haven't had to deal with it.
Yeah. So what's going to happen is it goes into the system like it normally does as a vaccine site, it's a state vaccine site. And generally what's going to happen is if you're on there, you can see Uxbridge will be on there. And it basically will, they're going to have responsibility reporting how much vaccine is there and utilized. And they will, people will be able to use that site to go there to get it. Now, chances are the more you have local regional sites, people are going to be more apt in those areas to focus on getting appointments in their local areas. So,
right.
You can't discriminate against any other city or town that might want to go there. I think with the mass vaccine sites and all the sites that we're going to have regionally here that we're in that announcement yesterday, I think what you're going to see here is more and more availability, distribution of these vaccines. And what's going to happen is if there's a lull in the vaccines and how much vaccines they have, they'll pull back on appointments. But again, with this new system that was implemented yesterday, you will get a phone call from us, a phone call from the state saying that this is, we got your appointment, and they replenish the vaccines. Again, everybody has to realize, Governor Baker's under the direction of how much. I mean, we order 400,000 vials of vaccine, right?
Sure.
We only get 100,000.
Yeah.
We got 1 million people trying to get 100,000 appointments. So I get the computer system was very difficult. I understand that. But that's the problem. The system was made to handle large velocity of appointments and things. So when you've got this mass user going on there, it does confuse the system, and it logs it down, and it does get confusing on how to do it. And a lot of people don't understand you have to hit refresh and things.
Right.
One of the things I have done, I've got somebody that I brought on to my campaign, and we'll be launching that also on Monday, that folks can go to my site. They can, if they need some help, they can put their name and address in and some questions they got to answer that are asked on the site. And I have somebody that's working 3 days a week, volunteering for my campaign, and helping us out, going in and helping those folks that just have a tough time navigating a computer system in general.
Yeah.
And we're going to get them in there, and we're going to help them, through the system. So we'll let them know, hey, your name's in there. They'll call you when your appointment is available. But Monday is going to be a great day. We're going to talk more detail of it. I don't want to get into the details. I don't want to take it away from the locals. All the locals in these towns, they work so damn hard for this.
Yeah.
I don't want to take anything away from Monday's press conference.
Yeah.
And I think you're going to see a lot of proud people there from all different towns. I'm very excited about this.
Well, we're looking forward to being there. And like I said, Johnny Wilbur would be there representing MyFM.
Great.
We have a question. Christine is asking if everybody is allowed to get vaccines now, but it's still only in the second phase, right?
Yeah, it's still going to keep the phases going. We're going to still keep things moving.
Yeah.
Listen, we've got a lot of groups that need it. We need a lot of groups that need to get it. And,
teachers are coming up soon, right?
Yeah, I mean, teachers are coming up, but I also want to get these food folks, grocery store folks.
Sure. Yeah.
I want to get them going, and they need it. I mean, these folks have never quit from day one of this pandemic.
It's true.
They've been exposed to this pandemic more than anybody, besides nurses and doctors and EMT workers. These folks have been just as much exposed to it. I would say if you're going to rank them, they're probably within that fourth position category.
Yeah.
I mean, I'm excited that teachers are getting it, and they should, but they're dealing with low risk.
Yeah.
They're dealing with children that, the proof is in the pudding. They can catch it from one another, but they really can't, transmit it from students. So, and that's been proven with all the private schools that opened up in September, that, they were going as business as usual, and their contraction rates were great. So, they were very careful. They showed us a roadmap on how it can get done. So
we've been thanking the retail people from the start.
Yeah.
And thanks for the reminder. I got to thank them again.
Yeah.
Because like you said, right from the start, they've been at it. They've been
Yeah,
going to
small
work. They've been
business.
dealing with the public.
Yeah. And these small business owners and, construction workers, I mean, a lot of our union labor guys, I mean, they're in close contact with each other through this whole entire pandemic, working in, buildings and trying to keep going on buildings that they have contracts for. They never stopped. So there's we got to get enough vaccines going so that, I personally like the way Israel's doing it. They're taking down the bureaucracy and just kind of like, hey, anywhere you can get it, you should get it. It seems to be really working well there. I mean, I think they're going to be the first nation that's going to be fully vaccinated, and they're going to be getting back to normal, which I think is a great roadmap for us.
Yeah.
If there's any country out anywhere else that's like the United States, Israel certainly is, and I would definitely look at that as a roadmap to how we should really be looking at it from a state by state basis. If we just take Israel and say, it's each state should run it like that, that's how we should do it. New Hampshire's doing a fantastic job. I think the struggles here are our population is bigger. I mean, New Hampshire's doing a great job, but also our population per county is much higher than theirs. So, we're getting there. This is great news. We're moving forward, and we're looking forward to all the restrictions starting to loosen up. And yes, we are hearing that. I didn't want to confirm that or deny that, but I will probably confirm most of it, that you're going to see some of these restrictions starting to ease up. I think if these numbers keep going the way they're going and the vaccination rate keeps going up like it is, I would say by summer is a pretty safe bet that we are going to be moving on. And I'm also happy. My mom, as her doctor's appointment yesterday, she is fully vaccinated. So I don't have to lose sleep over, God forbid, if I got it, if she's going to be exposed to it.
So, that's great to hear.
Yeah, it is.
Well, we look forward to everything on Monday and learning more about the new center that's opening up for the vaccinations. And congratulations to everybody who was a part of that, and especially you. And there's a lot of thank yous on the comments section. If you want to jump in there, there's a few questions as well.
Sure, we will definitely look at that, man. Thanks, Pat.
Right. For everything else, SoterRep.com. Yeah, right. And those will go by fast. So
those will go by fast. They will, man. Thanks.
All right.
Thanks,
Mike. Take care. State Representative Mike